Hey guys, and welcome back to Doris's Daily Deets, where I discuss everything from fashion, beauty to lifestyle. And today's video, as you can tell by the title, is none other than the long-awaited 2-month breast reduction update. Okay, now before we get into the video, you guys already know what I want to say, but yes, if you're not subscribed, make sure you go ahead and click that subscribe button. And if you have not hit the notification bell yet, not sure what you're waiting for, but make sure you go ahead and do that too. It's somewhere down below. And also make sure to comment, share, and also follow me on all my social media accounts. So on Instagram, I'm at the_queen_D, and at Facebook I'm at Doris Yvette, and those are my two most active platforms. And again, like I said, just make sure you guys are interacting with me and all that good stuff. But I'm pretty sure that after I give this little update, you will. So without further ado, we are going to go ahead and get into the video. Alright, I failed to mention to say that this is Vlogmas day 13. And I hope it's really 13, y'all, because I'm getting so mixed up with these dates. And if you guys have ever done Vlogmas, you know what I'm talking about. It's just so hard to kind of keep track with everything. So, yes, this is Vlogmas day 13. And in the previous vlog, probably 2 days ago at this point, you would have heard me talk about how I went to the doctor to get a follow-up appointment just to see how I was doing post-op, how I was coming along and all that good stuff. So I just wanted to kind of update you on how I'm feeling, how I've been doing, because ironically enough, the last time I talked to you guys about my procedure, I was only 2 weeks post-op. So I am just really, really excited to update you guys on how I've been doing. So I'll first start off by saying, everything went well with my breast reduction surgery. I have no regrets at this point. I'm very satisfied with how I look, the size of them so far, and I'll get into that a little later. And just the whole process in general has just been very, very amazing. It's been a really, really good process. So I just want to just first start the video by saying that. Now, as far as how I'm doing, my progress and all that good stuff. So according to my last appointment, I am healing up fine. They did recommend me get something called silicone sheeting, which I will post a picture somewhere. So it's basically just like some sheeting that you put on the scars and everything to kind of help with the healing or whatnot. And I don't have any pictures to post because I think sometimes it's kind of weird for me to come online with my chest out, but you guys get the drift. So, I mean, the scarring is not horrible. I've heard some people say where their scarring is just like really severe and it's just like the worst thing ever. And I'm not feeling like that. Like, I'm feeling like I could really honestly like wear things like that are low cut. I've tried on things that are really low cut, deep plunging things. And anybody that's seen them has not seen any scars. So I feel like all of that really does, look good on me at this point. The most places that I think you may see scars is I have something like a little underneath on the sides for where they did the lipo at, and that maybe about this stretches out, I guess, about this thick, so maybe like right here. But a lot of things that I wear will cover that anyway, and then of course all that can go away over time. Now, as far as the scarring and what I'm doing to kind of help get rid of the scarring, I'm using vitamin E oil. It's just some Palmer's vitamin E oil that I picked up from my local discount drugstore. And it was about maybe $5. And that's all that they really recommend. They recommend you use it twice daily. I will say that I'm not that good with it because I'm not good with doing anything like that 2 times a day that comes to like body care. I'll just be honest with you guys, but yeah, anywho. But I mean, that's what they recommend. And then they recommend a silicone sheeting because since I'm African American, I am more prone to keloiding. And I should say as a whole are more prone to keloiding with our skin type or whatnot, just because of the pigment that's in our skin. So he recommended that I massage them daily, and I'm like, massage, what do you mean? And he said basically just like kind of go in a circular motion like this at every area of the scar to kind of help prevent that, and also use that silicone sheeting. I believe the silicone sheeting retails for about like around $80, but it is something that you can kind of wash and keep reusing. It's kind of like an adhesive type feel, and you kind of just put it on top of your scars, and it kind of comes in the shape of how the scars are already being done. So I will get that soon. I wasn't prepared to get it the day of my appointment, but I definitely will go ahead and pick some of that up soon. So that's what I'll do next, and I'll go ahead and see how that goes. He did say they are still swollen, and then at first they have like a square shape. So basically they don't fall into their normal figure until like, maybe about 6 to 7 months post-op, from what I'm gathering. Everybody's different, and it really just depends on the body type, but from what I'm gathering, maybe somewhere around there. So they don't recommend that you buy any bras or anything like that. So right now I've just been wearing some really cheap sports bras that I've purchased from Walmart, maybe for under $10, and I just interchange those. And for the most part, yeah, that's pretty much all that all that's been kind of going around, the actual scarring and stuff like that. Now, as far as the pain and feeling and all that, I do personally have feeling in my nipples, which was kind of something that I was just, a little worried about, because if I ever want to breastfeed or something in the future, I just wanted to kind of make sure that, all my nipple sensations and all that came back, because I didn't really want to have any issues with that. But when you do get breast reduction surgery, that is one thing that you're at risk of, and that is kind of losing the ability to be able to breastfeed, or the ability to have feeling in your nipples. But I will say that I feel like my nipples are like extra sensitive, to the point where any little thing is like, whoo, like that brushes up against them. I could like feel it. If it gets cold, anything, I feel like they're just like boing. I'm just kidding. But yeah, that's how it feels. And as far as the swelling, I didn't really know that they were still swollen. I thought maybe that's how they were supposed to look. But I did notice when he kind of like touched in certain areas, I could feel where it was kind of numbness or whatever. So I did notice that. So I'm like, oh, okay, now I see why he's saying they're still swollen a little, which he said was perfectly normal. And that's where the massaging and all that is going to come in to help, which I did not know prior to my appointment that I was supposed to be doing it. So I'll go ahead and I have already went ahead and started doing that. But as far as pain goes, the only thing that I really feel every now and again is I get these like sensations, like, and this is perfectly normal too, but it's like your nerve endings are kind of all coming back together after surgery, because you got to think when you're undergoing something as major as something like that, and it's a very extensive surgery from what I hear. I'm not a surgeon, but from people that I know that do surgeries, I hear breast reduction surgeries are one of the more tedious types of surgeries to do. It takes a lot more work, and there's just a lot that goes into a surgery like this. So basically what happens is you kind of start to feel your, you kind of start to feel like the nerves kind of come back together, and it almost feels like you're getting shocked or something. I mean, I've never been struck by lightning, but if I were, I would imagine that would feel something like that. Almost like when you get, like when somebody shocks you from like clothing or something like that. Like I'll feel sensations like that randomly. And it's not even like it's sporadic. It's not like I could say, oh, every day at this time, or no, it's like super duper sporadic. So that's something that, is different, but it's nothing unbearable. It's just weird to say the least. And one other thing that is really weird that I've been experiencing is itching. Oh my God. So I watched in other videos where they said like, you will experience, some itching after the surgery. Whoo, child. I feel like once I said it, they just started itching right now. But yes, the itching sometimes, like, I'm like in certain positions where I can't even stop and scratch them, or I'm talking to somebody and I really just want to be like, ugh. So yes, the itching sometimes is just crazy, and it just comes out of nowhere. That's something else that's just like super duper sporadic. But yeah, it just comes out of nowhere, and at first I didn't feel it, so I'm like, I don't know what they talk about with this itching, but yes, now I know. Like sometimes I'll just randomly just be sitting somewhere like, oh my God, my chest itches so bad. But yeah, but overall, yeah, everything is, doing well. So far, so good. This particular appointment, they told me to come back in a month to meet with the nurse. And in a month, what they'll actually do is they'll actually do a massage for me there in the office. Because again, like I said, it's a medical spa. And they do other things there besides just surgery. So with my surgery, one of the services that I'm going to get is a massage with a massage therapist who's going to actually massage the scarring too. And he said at that appointment, I'll actually get, more instructions on exactly, how to correctly be massaging them and everything like that, just to, have a speedy healing process. And then I have to meet with the nurse just so she can kind of look over everything. But yeah, so if you have any questions, let me know. I'll go ahead and kind of let you guys get a side view. That's why I purposely wore this tight shirt. So my chest, I do still have some fullness in my chest area, which is perfectly fine. That's exactly what I wanted. So I'll go ahead and let you see from this side. I definitely still wanted, you know, a chest. I just did not want like a chest like this. So right now I'm like, you know, real comfortable. I won't know what size I am until at least, like I said, later down the line. So I always get that question like, what size are you now? I'm not 100% sure. As soon as I find out and get to go bra shopping and all that good stuff, you guys will be the first to know. But I just want to let, you know, just update you on that, let you guys know how I'm doing with my day-to-day life and day-to-day activities. Oh, and I have no restrictions at this point, which is really good. So I'm going to assume that means I can kind of start taking baths again. For a long time, I was not able to submerge them underwater at all. But he said at this last appointment that I have no restrictions anymore. So that's good. I'm going to start working out again, which I could have already been doing, but I really have been putting it off. But I hear that working out actually really does help with the recovery process as well. So that's something that I really am going to start back doing probably next week, even though I say that every week. So hopefully you guys will keep me on track with that. And I'll also vlog, you know, when I finally do decide to go back to the gym and kind of just let you see how that goes. Other than that, I feel like I'm rambling now, and I feel like that was a boatload of information, but I hope that helps anybody out there who's looking to get a breast reduction surgery. Comment down below if you have any kind of questions. I am so happy to help you, especially for somebody who's firsthand had the experience. It's definitely something that I don't regret doing. I'm still very happy with my results, very happy with the recovery process and how speedy it is. So on that note, I'm going to go ahead and end the video here. I want to thank you guys so much for watching. Again, like, comment, subscribe, all that good stuff. And I will see you guys in the next video for Vlogmas Day 14. Bye, guys.